Dr. Ron Valdiserri, and I'm reporting to you from the 19th International AIDS meeting here in Washington, D.C., and it's my distinct pleasure to be able to talk with my colleague, Ms. Kathie Heirs, who is the Chief Executive Officer of AIDS Alabama.
Thank you so much, Ron. Happy to be here.
I want to talk to you about AIDS in the southern United States.
Okay.
And I know this is what you do for a living. You've been passionate about this, but can you tell our viewers why do you think we're hearing so much more lately about the problem of HIV/AIDS in the South?
Well, I don't think the issue of AIDS in the South is new, but I do believe it's growing, and it has continued to grow over the last few years. And one reason I think you're hearing more about it is that for about 10 years we've really been pushing to get the story out there. And you know, sometimes it just takes a little time, but people are beginning to catch on. But I also believe another reason you don't hear so much about it is just because there aren't that many Southern voices at the various tables.
You direct a large AIDS service organization in Alabama.
Right.
Can you share with us some of the particular challenges, especially in the rural South, you
Yes.
think that people living with HIV/AIDS are facing?
Well, even in Alabama, the challenges are different because I'm actually based in Birmingham, but my agency is statewide. So when you get outside of the urban areas, you know, there's no bus system, there's no transportation whatsoever, and most of our clients are extremely low income. Most of them with their benefits make about $10,000 a year. Most don't have vehicles. And when you're in rural America and you don't have a car and your doctor's appointment is 2 or 3 hours away, that's extremely challenging. So I have to say transportation is definitely one of the issues. A second issue that is really pronounced in the South are just the lack of providers. You know, we have almost half the epidemic and only about a quarter of the doctors. Additionally, because we have such vulnerable populations, you know, we're talking extremely poor, as the CDC pointed out a couple of years ago. And so most of them have no insurance. There's just not a lot of access.
Sure. I know there's been a lot of innovation, your agency included. Can you share some examples of approaches that have been used to try to address some of the particular social impacts of HIV/AIDS in the South?
I can think of two real concrete examples of an innovative approach. I think the first is the way we all collaborate and work together. There are 10 AIDS service organizations and 9 Ryan White clinics. We are all very connected. We actually meet every other month, sit down at the table. We have the entire state divided up so that all 67 counties are covered. I don't know of another state that has that kind of collaborative approach, and we all need to move toward collaboration. You know, I know the government in this administration has been fantastic about trying to break down those silos and the different departments working together. Well, that's kind of the way I look at it, because what my dream would be for whether you live in Pineapple, Alabama or Birmingham, Alabama, to be able to get access to quality health care, housing, you know, the different things that will allow people to stay healthy and in care. So that's one thing that's innovative about Alabama. And one program at AIDS Alabama that I'm very proud of is called Beauty in Knowing. And we actually have developed a curriculum. We're going out into cosmetology schools, and we're teaching young African American women about HIV, self-esteem, you know, all these important components, domestic violence, and then they're going out into their salons and their practices and disseminating the information to the public. So, you know, I think that's a good example of trying to get into a population in a place where they talk, you know, really talk.
Well, I appreciate both those examples, and especially like the fact that you called out the National HIV/AIDS Strategy, which is celebrating its 2-year anniversary, and really is a way that as a nation we can try to refocus our efforts on HIV/AIDS. One last but very important question. There's been a lot of focus on the special needs of women in the South, particularly poor African American women. Can you talk a little bit about the kinds of comprehensive services that we need to put in place for those women?
Well, definitely intimate partner violence, domestic violence is a huge piece. There was a doctor in Montgomery actually trying to do a study with a professor at the University of Alabama about domestic violence and women with HIV, and they were trying to form a control group. They couldn't find enough women who had not experienced domestic violence to form a control group. You know, so that's a huge issue. And of course, women do have unusual needs. I mean, child care, reproductive health rights, and what I have seen over and over again, if women have children, and most of our clients do have children, several children, and when you have kids, the woman is going to put their needs before their own. So, you know, that's challenging, trying to get women to understand that if they don't take care of themselves, then there's not going to be anyone to take care of the children. And you know, one that people don't think about very often, did you know that in Alabama at least, women stay homeless longer than men do? We've made a commitment at AIDS Alabama to not only try to get these women in care, but also to try to help them get back into the workforce and, you know, back into society in a productive way.
So let me close out by saying, and I've worked with you for a number of years, so I know your commitment to HIV/AIDS.
Thanks.
But if you could share in closing a thought with our viewers about how we as a nation can do a better job addressing HIV/AIDS in the South. We
are not arming our children with the information they need to make good decisions. And I think that's an area we can really work on. You know, I know my staff and I are working on it because there's not much I feel more passionately about than that. You know, the fact that of our entire HIV portfolio, only 2 or 3% of it is spent on prevention is wrong. You know, and not telling kids how they can get HIV is just wrong. So that would go a long way if we could get into the boards of education and the PTAs and the different school systems and change that. I'll add to Kathie's sentiment in that we all have to recognize that if we really want to achieve an AIDS-free generation, this is not just a job that we can leave up to doctors and nurses and community advocates and people who work in public health departments. It really has to be all of society coming together and doing what they can to keep children, young people, adults healthy and happy and productive. That's right. And if we want an AIDS-free society, we have to deal with the South. This is Ron Valdiserri with my friend and colleague Kathie Heirs, reporting to you from the 19th International AIDS Meeting in Washington, D.C. Thank you so much, Kathie. Thank you, Ron. It's a pleasure.